In this module, we focus on one of the core therapeutic tasks in prolonged grief disorder, helping the client reconstruct meaning and reestablish identity after loss. PGD is not just about missing the person who died, it's about the collapse of the world that existed with them in it. This includes routines, roles, self-story, and the client's sense of who they are now. Loss often challenges the core frameworks through which people understand themselves and their world. When meaning reconstruction does not occur, the person can become fixed in a pre-loss identity that is no longer viable. These components outline the adaptive trajectory of grief. PGD occurs when one or more of these processes remains stalled. Most commonly, identity reorganization and role re-engagement. Identity reorganization is a central therapeutic focus in PGD. When the deceased played a defining role in the person's life, the absence creates a sense of identity discontinuity. Treatment supports the development of a revised, sustainable self-concept. Re-engagement is not the absence of grief, it is the capacity to participate in life while carrying grief. Treatment supports the client in resuming meaningful activities and relationships without forcing closure or emotional resolution. In this module, we consider the ethical responsibilities clinicians hold when working with prolonged grief disorder. Our focus is on avoiding harm, respecting individual and cultural mourning practices, and pacing treatment in a way that protects emotional stability and autonomy. It is not clinically or ethically appropriate to label grief as disordered simply because it lasts, or because the emotion is strong. Intensity is not pathology. Our responsibility is to determine whether the grief is interfering with life, not whether it is painful. Different cultures, families, and communities have distinct expectations about how grief should be expressed and for how long. A presentation may feel intense or prolonged to a clinician, while being entirely normative for the client's background. Cultural proportionality must be integrated into every diagnostic judgment. Exposure to grief-related material must be paced thoughtfully. If we move too quickly, the client may shut down, dissociate, or withdraw from treatment. PGD therapy requires careful monitoring of emotional tolerance, not pushing the client to move on, but supporting gradual integration. Not all grief presentations require specialized treatment, but PGD often does. If trauma responses, substance use, or severe depression are dominant, those conditions require primary attention. Ethical practice means recognizing when to refer or co-treat rather than attempting to manage all components simultaneously. Working with grief can activate our own histories and emotional patterns. Ethical, attuned work requires awareness of when our reactions, compassion, avoidance, urgency, or over-identification, are influencing treatment. The therapeutic stance in PGD is steady, grounded, and non-directive in outcome. Prolonged grief disorder is not about how long someone grieves. It's about persistent separation distress that interferes with functioning. Distinguish PGD from depression and trauma by identifying the primary emotional driver. Treatment is structured, targeted, and paced. When trauma or severe depression are present, stabilize those first before grief integration. This checklist provides a practical sequence for evaluating and treating PGD. Start with context, identify the emotional engine, evaluate function, confirm with standardized tools, and select the treatment path that matches the clinical presentation. In this case, the emotional driver is separation distress, not trauma or depression. This is a PGD presentation, and grief-focused treatment is appropriate. Apply the diagnostic distinctions and treatment sequencing discussed today to your current caseload. Identify who needs specialized PGD treatment, who needs supportive grief care, and who may need trauma first or integrated intervention. That concludes the training. Thank you.